Welcome to the Adams County Historical Society. My name is Antigone Ladd, and I'm very pleased to host this program, which is part of our series of the aftermath of the Battle of Gettysburg. Our speaker tonight is Dr. Richard Schrader. He is eminently qualified to speak about the medical care here because he is himself a doctor. He is in the field of orthopedic surgery with a specialty in orthopedic trauma. He is also a licensed battlefield guide, and in this talk he will explain the medical services available to the wounded. He will talk about the dire need for physicians, for volunteers, for supplies, and he will also talk about those who filled the needs. He will point out the spots around the town of Gettysburg, the farm buildings, the homes, the private homes, the churches, all that became hospitals in the aftermath of the war. So I'm turning the program over to our speaker, Dr. Richard Schrader. I have a question for you. Knowing your background as a trauma surgeon, which certainly is not an easy job, but I'm sure is always stressful and constantly demanding of you, how did you decide to retire and become a licensed battlefield guide, which to me is not the ideal job for easy relaxation and all?
Well, every story has a beginning. While being an orthopedic surgeon specializing in orthopedic trauma was stressful, it was also very stimulating and rewarding. I decided to become a guide because I love studying the battle. I got to the point where I thought, I think it would be wonderful to take people around and tell the stories of the men who fought here. I don't think I appreciated how difficult it was to get a license. I knew vaguely of it, but as I started to study it, by the time I got into it, I realized, and I tell people this right up front, it's a lot easier to get board certified as an orthopedic surgeon, Antigone, than it is to be a battlefield guide at Gettysburg. I've taken a lot of tests in my life.
Right.
You don't get through medical school and not be good at taking written tests, but the testing process to become a guide is very difficult. And as many people know, it only starts with a written test, and then you have to go through an interview process, and it culminates in an oral exam that's a simulated tour, and you get 2 chances to pass that tour. But I found it to be very stressful, in many ways more stressful than what I would do when I went home to Johnstown on Monday to start doing during the week. But and many people have to go through it more than once. I did. I wasn't successful the first time through, but the reward is tremendous. The only real stress involved in being a guide, I think, is sometimes it's as simple as anticipating weather. Is it going to rain, and where am I going to go if it's rainy? Where are we going to find shade on a hot day? How hard is the wind blowing up on Little Round Top? So, there's sometimes self-imposed stress because I'll get asked questions that I disappointingly don't know a real good, solid answer to. And so I'm making a little checklist that, well, I need to go home and look up this unit or know more about why that happened over on Culp's Hill. So part of the fun of this is just continual learning, like anything that stimulates you.
Interesting. So you started while you were still in medical practice and doing weekend tours here in Gettysburg?
Yeah, I passed the guide exam and became a guide in 2016. This was my 6th summer. And I retired in 2020. So for 4 years, I would come out on the weekends and do tours and then go back to my orthopedic practice in Johnstown. And then my wife and I relocated out of here when I retired 2 years ago, which is wonderful, wonderful.
So thank you very much for being here. And let's go look at your tour of the medical facilities and the medical services of Gettysburg.
Well, thank you so much for the opportunity to present this program, Antigone. Today, I'd like to discuss aspects of the Battle of Gettysburg that sometimes are not explored as much, and that namely, that's the medical care at the Battle of Gettysburg. The presentation is divided into two parts because it's a topic that's not as well known. I have an introduction as to the state of medical care in the 1860s, and then the latter half to 2/3 of the talk is if you will, a hodgepodge of hospitals here in Gettysburg. Well, we'll relate some of the stories that were involved in medical care. On the title slide, you'll see two iconic buildings that when we talk about the medical care in Gettysburg, the George Spengler Farm and the Lutheran Theological Seminary. These are all pristine-looking structures now, but we need to remember that at the conclusion of the Battle of Gettysburg, on July 3rd, 1863, these buildings were teeming full of wounded and dying soldiers and the medical staff to take care of them. So as I said, we're going to break the talk into two parts: surgery and anesthesia in the Civil War, and then specifically surgery and anesthesia at Gettysburg. The first qualifying statement I really should make is, while we tend to focus on surgery and anesthesia in these battles, the medical staff in the Civil War was much busier taking care of illness than injury. 2/3 of the people who died in the Civil War died of illness, not of injuries. Illnesses like mumps, measles, cholera, malaria. Diarrhea, as distasteful as that is to talk about, was the biggest killer in the American Civil War. The medical care evolved over time. On the screen on the left side, you see early in the war what a division field hospital looked like, basically a yard full of wounded soldiers. On the far right is a depiction from surgery being done at Camp Letterman here in Gettysburg. And that is a real operation being done, because one can see that there's blood in that black and white photo streaming down the edge of the table. And we'll spend a good bit of time talking about the gentleman in the middle, one of my heroes here, Dr. Jonathan Letterman. If you want to learn about this topic, I've thrown in a number of references. I think this is one of the best books about all phases of medical care. Civil War Medicine, Challenges and Triumphs by Dr. Bollett covers a lot of information. I learned a great deal when I read this book initially after I became a guide. And we're going to talk briefly about medical education, because becoming a physician and learning how to be a doctor was much, much different in the 1850s and 60s than it is now. And then, as we're going to talk about wounded soldiers, what surgery was like at the time. Medical education in the mid-19th century was a far cry from what we know now. Europe was really the seat of sophisticated medicine, with America kind of riding Europe's coattails. Physicians in the 1840s and 50s who wanted to learn about then modern medicine would go to Paris or would go to Berlin or to Britain. Really, the United States, because it was a new country, its education system was new. And like many things, it was almost by an apprenticeship. Basic science was being done. Nobody understood the germ theory. Nobody understood concepts of sterility. And the American physicians were learning how to practically take care of their communities, how to set broken bones, take care of pneumonia, take care of childhood illnesses. Very few surgeons and physicians had actually been in position to do very many operations. And the picture on the right side of the screen was what a medical lecture hall looked like. The seats are more comfortable now, but it's still often raised up on tiers. The curriculum was same all the time. It was a 2-year program. You attended class for 6 months, and then you went out to apprentice, and then you came back and took the same courses the next 6 months. And at the end of the 2 years, you could apprentice with a town physician. Now, at the start of the Civil War, in light of this type of medical education, the Army Medical Department was quite small. The standing army was quite small, and consequently the Army Medical Department was quite small. As you can see on the slide, at the start of the Civil War, the Army Medical Department only had 113 physicians, of which promptly 24 of them joined the Confederacy. And you can see on the slide how this expanded by the end of the war, with more than 12,000 physicians and surgeons working for the U.S. Army. At the start of the Civil War, the Army had one hospital, and it was conveniently located in Fort Leavenworth, Kansas, and it had 40 beds. So there really were no large major hospitals. By the end of the war, as we talked about, the Union Army would have one surgeon for every 133 men. The Confederate Army, as many students of the war and battle know, usually faced shortages, whether that was in personnel or material. The Confederates had one surgeon for about every 312 men. But again, to get our perspective of how medicine was practiced in this day and age in our country and in the military, the entire Union Army at the start of the Civil War only had 20 thermometers. I alluded to this earlier, that most of the care that the medical staff rendered didn't have to do with injuries sustained in battle. It had to do with medical illnesses or injuries sustained when large bodies of 23-year-old men were marching or in camp doing what 23-year-old men do, and maybe hurting their ankles and dislocating shoulders. But as you can see from that statistic, every man in the Army generally had 2.5 to 3 events while they were enlisted that took them to the medical department. But whether it was a cold, whether it was an intestinal problem from bad water, soiled food, or whether it was injuries. But again, it's important to understand as we start to focus on injuries and surgery that there were twice as many medical illnesses that had to be taken care of than injuries by the medical staff. The book in the lower right, Letters of a Civil War Surgeon, is representative of many publications that are diaries of Civil War surgeons. This gentleman was the surgeon for the Wildcat Regiment from the Indiana, Pennsylvania region that fought here at Gettysburg, and he's from Bedford, Pennsylvania, which is near where I used to practice in Johnstown, Pennsylvania. The reason that wounds were so different in the Civil War was this fact. The ammunition had changed significantly from the Napoleonic Wars at the turn of the century. Bullets, if you will, or mini balls, now came out of rifle muskets spinning and were more able to kill at an extended distance. A smooth-bore musket ball was lethal out to 100 yards. These rifle bullets or mini balls, that's a anglicized version of Claude Etienne Minier's name. We call them mini balls, but it could kill out to 300 to 400 yards. These were large, soft lead bullets. When they hit the bones in the arms or legs or back, the soft lead would deform, and that would shatter bones. It would rip out tissues. They were devastating injuries that were caused because of the change in ammunition. The nature of the wounds sustained by soldiers is interesting to study. The vast majority of wounds in the Civil War came from bullets or small arms fire, and we talked about the range of the mini ball. A surprisingly low percentage of injuries were caused by artillery. Now, this is somewhat of a biased statistic because if a cannonball hits you or you're hit with a load of canister, there's not much left of you maybe to be injured. And so the lethality of artillery, the ability for it to kill, was a little more effective than what you see on the slide. But just understand the vast majority of wounds were sustained by bullets. Very few wounds were sustained by, as we call them, edged weapons, bayonets, swords, sabers, and quite simply that's because the effective range of a bayonet is only about 3 feet. This quote from the Battle of Spotsylvania Courthouse puts that in perspective, one of the surgeons commented that he treated 14 bayonet wounds in this multi-day battle, and probably as many men were severely kicked by mules as were injured by bayonets. This slide depicts the nature of the wounds that these men sustained. This is a illustration from a large multi-volume publication called The Medical and Surgical History of the War of the Rebellion, which documented both medical and surgical treatments through the war. But you can see the distribution of injuries here. It's about 1/3 upper extremity, 1/3 lower extremity, and if you combine head and neck and trunk, it's about 1/3 there. But you need to appreciate the difference in mortality, or how likely was it that you would die from an injury in this region. Mortality in upper extremity injuries was low, significantly more in lower extremity injuries, and that's largely because the bones, blood vessels, and nerves are bigger in the legs, and so bleeding can be more of a problem. If you were struck in the trunk, the chest or the abdomen, you can expect a correspondingly higher mortality rate of 50%. Actually, if you were struck in the abdomen, the mortality rate was 98% because there was no real way to do abdominal surgery and avoid the onset of infection, as there were no antibiotics available. If you're shot in the head or the neck, and that would include the facial area, the mortality rate is high. A brain injury, a spinal cord injury is still going to cause a high rate of death. But many soldiers sustained facial injuries, some of them really quite serious, but those were survivable injuries. The bottom line is, if you're wounded in the Civil War, the likelihood of you dying of your wound was not as high as people think. The mortality rate for Union soldiers for all injuries was only about 10%, and it was 15 to 20% in the Confederate Army. So the misconception that medical care in the Civil War was poor is not accurate. But of course, as a retired orthopedic surgeon, I suppose I'm a bit defensive about that. This is an illustration of the volumes that I just referred to, the Medical and Surgical History of the War of the Rebellion. This was published before the official records came out, and those are very large volumes. It is a 6-part series, and it doesn't have photographs, but you can see the nature of the illustrations that were there on the previous slide and on this slide. Very graphic but accurate depictions of immediate wounds and the aftermath of wounds, such as infections and problems that the injured soldiers and the medical staff face. When I give a tour as a licensed battlefield guide, I don't delve deeply into medical issues unless my visitor wants to, but I try to make sure that every visitor takes away 2 medical facts from any tour on the battlefield. I've already given you one, that medical illnesses outnumbered injuries 2 to 1. The other misconception that is very common is that surgeries were done without anesthesia in the Civil War, and that's just not true. 95% of all the surgery in the Civil War was done under a general anesthetic with the patient asleep. And the 2 agents that were used were ether and chloroform. Ether and chloroform had been discovered in the 1840s. That didn't make surgery commonplace because we still didn't have any understanding of infection and no availability of antibiotics. But the ability to render someone unconscious, if you will, and asleep, to stop the pain of an operation could be technically done. Now, on a battlefield, chloroform was preferred because ether is flammable, and with bullets flying around or light by lanterns, that was felt to be somewhat of a disadvantage. When we talk about surgery in the Civil War, and we talk about injuries at Gettysburg, the operation that most people think about is amputation. Now, why were so many amputations done? Well, I've already mentioned that the ability to do abdominal surgery and have the patient survive was very limited, largely because of infection. Injuries to the chest were also, while not as likely to result in death, still 2/3 of people shot in the chest did die from their wounds. And quite simply, the 1/3 that lived were lucky because the bullet went through their lungs and didn't hit a major blood vessel, or certainly didn't strike around their heart or their esophagus, their swallowing tube. And being shot in the brain in the Civil War was just as lethal as being shot in the brain in this day and age. So the extremities were where surgeons could intervene. And amputations were done to save soldiers' lives. I think that's something that is not often appreciated. The ghastly wounds that these mini balls caused not only broke bones, but you could see from the illustrations, really tore apart the soft tissues. And technology in 1861 to 1865 did not allow any way to put bones back together like I did in my career. We spent hours really putting shattered extremities back together. That technology wasn't available then. And so the only thing you could do in the face of a severe bone and soft tissue injury to save the patient's life by avoiding infection, and we'll talk about that, is to remove the extremity. And while it seems ghastly, it saved lives, and it's important to understand that. Now, how an amputation was done then and how an amputation is done now are surprisingly similar. I tell people that if you walked into my operating room as we were getting ready to do an amputation, the instruments on the back table, while they're sterile and not in a velvet-lined case, are very similar to what you see in this surgeon's amputation kit. The surgical instruments that we would use to do an amputation in 2022 are very, very similar to what you see in that Civil War amputation kit. I do tell people that now the biggest difference is that we have batteries on our cordless saws, so we don't have to use arm power to cut through the bone. But the operation is done in a nearly identical fashion. The results of surgery, and again, we're talking big picture information here, not specific just to Gettysburg, but to give you an idea of this whole topic. The results of surgery, as I referred to earlier, were much better than people think. Records would indicate 60 to 70,000 amputations were done in the Civil War. Mortality rate for amputations was about 25% all across both the North and the South. I cited a mortality rate of 10% for all injuries. That mortality rate is specific for operations that were amputations. I've mentioned that there are no antibiotics. Penicillin is not really discovered until 1928. And so the vast majority of surgeries became infected. And it was expected that operations would get infected. 80% of them did. And is, again, distasteful as this topic may be, it's important to understand that physicians and surgeons in the Civil War were students of pus. Pus, of course, is the drainage that comes with an infection. And many people watching this presentation may have heard the terms or the term laudable pus. What's so laudable about pus? That's a term from the Civil War because it meant that the infection that the physician was looking at was not going to probably endanger the patient's life. And we know nowadays that that would be an infection from probably a staphylococcal bacteria. Other types of bacteria, and again, nobody understood germ theory at this point, caused other types of drainage. There was an infection called erysipelas, which was a strep infection similar to the flesh-eating bacteria that we occasionally hear about now. Gangrene, or the death of tissue, could set into the extremities, and these were all different forms of infection that could occur. And again, I want to emphasize, no antibiotics were available, but by the end of the war, antiseptics, or liquids that would clean up damaged or dead tissue, were used. And this became a very important advancement in the care of gangrene, and using a material called bromide solutions painted on the extremities would often stop the progression of the dreaded gangrene. Because of the conditions in hospitals where patients laid on the ground or in barns, there are flies everywhere. And in fact, the larval form of flies, maggots, were commonplace in these extremity injuries, and actually proved to be an advantage because maggots will only eat dead tissue. And so they provided a way to actually clean up wounds, and they couldn't be avoided because the flies were everywhere, but they did prove some benefit. Now, in addition to amputation surgery, there were some efforts to save limbs where surgeries called resections were done to remove the damaged portion of the bone, but not remove the extremity. Unfortunately, many of those resections resulted in what you see in the upper right-hand slide, which is a false joint where the bone never healed. And so now the arm and sometimes the leg would move in places and in directions that it wasn't designed to. But Dr. Letterman was adamant in the heat of medical care after a battle. The surgeons were not to spend a lot of time because it took longer to do a resection than it did to do an amputation. A Civil War surgeon could do an above-knee amputation in 5 to 8 minutes, generally speaking. And there were hundreds of wounded soldiers that needed to be tended to. Time was of the essence in avoiding the infection and death that these men were exposed to. We'll talk about the different levels of hospital care, but Camp Letterman is a general hospital that was established in Gettysburg. Most of the surgery was already done by the time the patients got to Camp Letterman, and you can see that the death rate at Camp Letterman is quite low, only 6%. Let's talk a little bit about Dr. Letterman and his system. Dr. Letterman had been in his position as the medical director of the Army of the Potomac for a year by the time the Battle of Gettysburg came around, and he had instituted this system, and it worked very well at Gettysburg in the sense that it decreased mortality or death rates because of the existence of the system. It was centered on layers of hospital care and rapid evacuation of the wounded from the battlefield by ambulances. This is a picture of Jonathan Letterman. He was born in Cannonsburg, Pennsylvania, just south of Pittsburgh. He attended Washington College and then went to medical school at Jefferson, and he was an Army surgeon. His plan that he put into place includes these multiple levels of intervention: immediate care at field aid stations, definitive care at field hospitals, but also a very detailed record-keeping system so that physicians in the future would learn from the care that was given here. This is a quote that I include really every time that I talk about Dr. Letterman. It's a quote from World War II. This is Dr. Paul Hawley, Major General Paul Hawley, and you can read the quote, but the most important sentence is the last one. And Dr. Hawley, Major General Hawley, said, "There was not a day during World War II that I did not thank God for Jonathan Letterman." So even today, we realize the benefits of Letterman's care in the Civil War in our current medical community. Probably the most important thing that he did was to establish a very effective ambulance corps. Oddly enough, at the start of the Civil War, the ambulances were controlled by the quartermaster department that dealt with clothing and shoes and food. Jonathan Letterman wrested control of the ambulances, which seems appropriate, away from the quartermasters and into the medical corps. And again, you can read these bullet points. This was not a haphazard organization. This was a very standardized system. Every division, and there would be 3 divisions in a corps, had an ambulance train, and each train, as you can see, had multiple ambulances, and each ambulance consisted of 3 men. These were all well-trained men in their role by the Battle of Gettysburg. These weren't just musicians who put down their horns to get people off the battlefield. And they were trained. These are large entities. These are large groups of men with a lot of equipment. And they were trained even to the point of the litter bearers knowing that the guy in front would step off with his left foot and the guy in back would step off with his right foot so that the patient wasn't jostled unnecessarily. Another very basic but important concept in Dr. Letterman's plan was this triage or categorization of injuries, and it utilized 3 levels of care. And on the battlefield here at Gettysburg, there are examples of all 3 of these types of care. The field aid station would have been the first place a wounded soldier would either get himself to or be taken to. And you need to think of a field aid station, other words that it would be used to describe that as a forward aid station, a bandage station, but think of it as an ambulance without wheels. There was one doctor at a field aid station, usually what's called an assistant surgeon, not one of the skilled operators, but their job is to stop the hemorrhage, get bandaging on, get tourniquets on. They didn't do surgery at field aid stations. These field aid stations were within range of the enemy's bullets and artillery shells. They are right up at the front. The one that's best documented on the Gettysburg battlefield is directly across from the Irish Brigade Monument on the Stony Hill in the wheat field to the 32nd Massachusetts Field Aid Station and Dr. Z. Boylston Adams. And many people watching this may know where this plaque is. If you haven't seen it, again, you need to look right behind the 5th Michigan Monument, which is across the road from the Irish Brigade Monument. You'll find that plaque to a field aid station. The soldiers were evacuated, and then they were taken to division field hospitals. That's where the surgeries were done. So every corps, and this was the same in the Confederate and the Union Army, would try to set up hospitals, usually by divisions, and each corps may have 3 hospitals if they have 3 divisions. And that's where the surgeons, while the initial triage would have been done out in the field, patients were put into 3 classes. If you had a minor wound that could be taken care of, bandaged up, and your recovery would be pretty quick. If you're mortally wounded, you're not going to survive this wound. You were made comfortable and set back out of the way. And then the most important group for the medical staff at these hospitals were the surgical cases. People and soldiers that could be helped by having an operation, which, as we talked about, was more often than not an amputation. And the 3rd level of this 3-tiered system, after the operation is done and the patient is stable, they would be transferred from that division field hospital to a general hospital. And general hospitals were often brick and mortar hospitals in York and Baltimore. For the Confederates, the Chimborazo Hospital in Richmond. Because of the sheer volume of wounded here at the Battle of Gettysburg, a general hospital was established as a tent hospital, It opened on July 22nd after the battle ended on July 3rd, and it's closed the day after Abraham Lincoln's Gettysburg Address, so it closed on November 20th, 1863. And the picture in the upper right is one of a panel of photographs that were taken while Camp Letterman existed, and that's just north of Route 30 East, basically across from Haas's Restaurant. And here's a map of what Camp Letterman looked like and was located. You can see it says York Road, Route 30. That's modern-day Route 30. This is a period map, and you'll see that some of the very important reasons that a hospital is set up are illustrated here. Roads, railroad access. You can see that the railroad coming into Gettysburg went right by the hospital. A good water source up on a hill, so there's good ventilation. And I might add, sadly, there's really not much to see at this site where thousands of men were treated and worked on by the medical staff. There's a medical marker to Camp Letterman. That's about 20 feet from Route 30, so it does become a little precarious to go look at that. In the background, you can see the Hilton Garden Inn, which is built on ground that was part of Camp Letterman, and the giant food store is behind that. So let's leave behind the general topics that we touched on and take a deeper dive into medical care here at the Battle of Gettysburg. Almost every tour that I give starts with these rather overwhelming numbers. There's 51,000 casualties in this 3-day battle. And it's important to understand casualties are killed, wounded, captured, and missing. The division of casualties you can see slightly more with the Confederates. At the end of the 3 days of fighting, there were 7,000 dead soldiers on the battlefield. And over the next month, another 4,000 soldiers will die of their injuries and the complications from those injuries. The term mortally wounded means you were wounded and then subsequently died of your wounds. That generally means over the next 3 to 4 weeks. The buildings in Gettysburg and the civilians in Gettysburg became a significant part of the medical care here. Nobody expected this battle to happen. With 21,000 wounded soldiers left in a town of 2,400 people, you can imagine that the civilians had thrust upon them a massive task, and they are a big part of the story. When the armies pulled out of Gettysburg on the night of July 4th into July 5th, there were 14,000 Union soldiers left behind as too badly injured to evacuate, and 7,000 Confederate soldiers in the same condition, so severely injured that it was decided they could not survive the trip back to Virginia. And scores of buildings in this town were used as hospitals. A hospital is any building that has injured soldiers being taken care of. I've seen the number as low as 60. I've seen it as high as 180. 160 is the number that I use. And many of those buildings still exist. The Adams County Courthouse in the lower left, the Solomon Powers House in the upper right, and the 1863 version of St. Xavier's Catholic Church. That church has been redesigned. But these churches, these homes, college buildings all became hospitals during and after the Battle of Gettysburg. The groups that took care of the injured soldiers came from many different directions. The Army Medical Corps would have been the first line of medical care that the soldiers encountered. But the Army Medical Corps was quickly overwhelmed by the sheer volume and also disadvantaged for two reasons. I mentioned that the Confederate Army was generally in short supply of everything, and when the Confederates left, they took a lot of medical equipment with them, leaving the Union Army Medical Corps without equipment. And it was only by the timely arrival of civilian organizations like the U.S. Sanitary Commission, the U.S. Christian Commission, that early on the Army Medical Corps was able to start to work again. The other problem the Army Medical Corps faced was their equipment was not brought up to Gettysburg in a timely fashion. The roads were left clear for ammunition, for artillery, for soldiers, and a large portion of the equipment for the Army Medical Corps was down in Westminster, Maryland, and so it had to be brought to the battlefield. So given those circumstances, it's not hard to understand how the civilians and townspeople were quite quickly pressed into action, and a very overwhelming response by volunteers. Civilian surgeons responded to the need, although they were variably welcomed by the Army Medical Corps. Volunteer nurses, women who got on trains, the Daughters of Charity from the convent down in Emmitsburg, whose stated vocation was nursing. But these organizations all played significant roles in the care of the wounded. The slide in the upper right shows what was then and is now known as the Fonestock building. There's another floor added to it, but that was the headquarters of the U.S. Sanitary Commission, and the Christian Commission's headquarters were on the Circle. in the building that now houses the Union Cigar Club and the former House of Bender. If anybody wants to delve into learning about this, there are many, many books available. I referred to Dr. Bollett's book for general medical care, but if you're specifically interested in the hospitals and the medical care at the Battle of Gettysburg, the first book you have to start with is Greg Coco's A Vast Sea of Misery, which I think was written in 1988. And very recently, building off of Mr. Coco's work, is James Gindelsberger's Bullets and Bandages, the Aid Stations and Field Hospitals at Gettysburg. Jim's book builds on Mr. Coco's book, and I would recommend both of them as excellent sources and resources to study the topic of care here at Gettysburg. When I became interested in this as I was a guide, I had read Mr. Coco's book, and I was in the Visitor Center Library beginning to become familiar with things like the medical and surgical history of the War of the Rebellion, and remember thinking it would be really cool, it'd be neat. Mr. Coco had passed away. If he could have taken selfishly me on a medical tour, and in the course of opening up a number of books, we happened across this handwritten note in Greg Coco's handwriting of his medical tour, and I've copied it. And if I do a medical tour, when I do a medical tour, it is very much based on the outline that Mr. Coco has written on that piece of paper. So let's talk a little bit about some of these specific facilities. And again, I'll try to give you resources and references as we talk. The first building I'm going to talk about is the Lutheran Theological Seminary, a very prominent structure on the face of the battlefield on the west side of town. One of only 3 buildings on Seminary Ridge at the time of the battle. It was a hospital for a long period of time because of its size and how many patients they could accommodate. It was open until the middle of September. At one point, there may have been up to 800 patients, both Union and Confederate, in the hospital. And it saw Union and Confederate surgeons working together to take care of those patients. There was a family that lived in the Lutheran Theological Seminary because that building was the classroom, dining hall, and dormitory for the seminary students. And Emanuel and Mary Ziegler and their family basically ran the building. They had 5 children. 2 of them remained in the home. The Zieglers left the seminary building as the battle rolled into Gettysburg on July 1st. And they returned on July 6th, and you can imagine what they returned to, the horrible sights in the building that really was their home. Their 2 youngest children, their daughter Lydia and their youngest son Hugh, both left reminiscences of what they experienced. And the title of that publication is The Dead and Dying Were All Around Us. And Hugh Ziegler very clearly describes the job and task he was given as a 10-year-old. It became his job to remove the amputated limbs from the operating rooms and take them out and pile them on the ground, something that no 10-year-old should be expected to have to go through. Not too far from the Lutheran Theological Seminary, the Pennsylvania College, now Gettysburg College, what was called the edifice, the large white building now known as Pennsylvania Hall, became a very busy hospital, largely for the 11th Corps, which, as many listeners know, had a large percentage of German and German-American patients. And ironically, many of the German language books in this building were used as pillows to support the heads of these injured German and German-American soldiers. There were some notable patients in this building. One of the notable Confederates was Colonel Waller Tazewell Patton, the, I believe, great-great-uncle of, maybe the great-uncle of General George Patton from World War II generalship. Colonel Patton was struck in the chest during Pickett's charge, but then his devastating injury was his jaw was shot off by a piece of artillery as he was climbing the fence on the Emmitsburg Road. Eventually, Colonel Patton was taken to the edifice building at Pennsylvania College. He couldn't swallow, he couldn't eat, but a very heroic effort to keep this man alive came from a volunteer nurse by the name of Euphemia Goldsborough. As Colonel Patton is deteriorating, he can't lie down because he can't breathe. Euphemia Goldsborough, who was not a very big lady, sat back to Colonel Patton to support him, to enable him to breathe until he finally did succumb to his injuries. Moving into the downtown area, and this is a painting by Mr. Dale Gallen showing the Adams County Courthouse in above the trees, and ironically, the Schick building is in the foreground, which was the Christian Commission headquarters. But this is as the Confederates are coming into Gettysburg. But the Adams County Courthouse became a very important division field hospital, that middle level of care in the three-tiered Letterman system for the 1st Corps, 1st Division. Now, when the wounded were taken to the hospitals, they were not meticulously divided into their own divisions and brigades. You went to the closest one, but the staff, the medical staff, would have come from these organizations. So the Iron Brigade medical staff was working at the Adams County Courthouse. About 250 wounded soldiers were cared for there, 77 amputations. When the courthouse was remodeled in 1906 and they were digging in the ground, many of those amputation limbs were come across. A young lady who's familiar to many Gettysburg people, Fanny Bueller, lived across the street, and she wrote that she noted that the smells and sounds emanating from it, as well as the sights, were too horrible to describe. Again, what's brought home to the civilians in their experience in this battle. Christ Lutheran Church, still in existence just off of the square. Again, a 1st Corps Division field hospital. This was known as the College Church at the time because the students from Pennsylvania College worshipped at this Lutheran church. 100 to 150 men were treated here. The Battle of Gettysburg was fought on a Wednesday, Thursday, and Friday. On Sunday, July 5th, the president of Pennsylvania College, Henry Bogger, decided to hold a service in this now hospital that was a church. And in the span of the time it took to hold the service, 5 men died of their injuries. One of the legends associated with the Christ Lutheran Church is that old Liz, who was a African-American woman who did domestic work in Gettysburg, escaped from her Confederate captors and hid up in the Belfry and was not taken south back into slavery. Many of these churches had organizations that we don't read so much about, but they were like the Sanitary Commission or the Christian Commission. The unit of volunteers that worked at the Christ Lutheran Church, and they have an excellent recollection of it, were the Patriotic Daughters of Lancaster. They came at the time the battle ended. They worked for a few weeks and they left, and they were so sorely missed that they were asked to come back and take over again. One of the events of significance, and I think Steve Mock in his presentation about civilians talked about this, Chaplain Horatio Howell was the chaplain of the 90th Pennsylvania Infantry. Their monument is the one that looks like a tree out by the short observation tower on Oak Ridge. Chaplain Howell was coming down the front steps of the church, which you can see at the lower left, and that monument marks where Chaplain Howell was mistaken for an officer and shot and killed by Confederate troops on the steps of Christ Lutheran Church. About 2 blocks away is St. Francis Xavier Catholic Church. The church that you see there now is not the same building that was there at the time. Again, you can see these churches accommodated anywhere from 150 to 300 wounded. If you go into St. Francis Church, there is a beautiful stained glass window that I have depicted here that shows the care of the wounded for both the Union and the Confederate soldiers. One of the famous civilian experiences that was documented by Sally Myers was that she went into that church and it was too much for me, and I went hastily out and sat down on the church steps and cried. But then she gathered herself and, as we know, went back in and did tremendous work for days on end after gathering herself as a 15 or 16-year-old young lady. Many of you have probably been to the George Spangler farm, probably the best example of I'll still use the term division field hospital. The unique thing about the Spangler farm, however, is the entire 11th Corps, all three divisions, were taken care of at this field hospital. I'm not sure how many of you have seen pictures of the Spangler barn before the foundation obtained it and did its amazing restoration. You can see the condition that the barn was in the upper left, and now the condition that it's in the current state. It was a large hospital. There were 1,900 patients there on July 4th and 5th, including Brigadier General Louis Armistead, who died in the summer kitchen, and the summer kitchen is a small brick structure enclosed by the white picket fence. He died on July 5th after sustaining what really should not have been mortal wounds. He was shot in the arm and shot in the other leg. Various reports say he was shot in the chest, but there aren't as many of those. But he died rather unexpectedly 2 days after his injury in that summer kitchen. And I would highly recommend, if you want to learn about division field hospitals and specifically about the George Spangler farm, to get a hold of a copy of Ron Kirkwood's Too Much for Human Endurance. Just an excellent treatment of how this hospital worked. And even maybe more rewarding would be to visit the Spangler barn and farm on a summer weekend when medical living history is being done there, and talk to the people who immerse themselves in this experience. The house is also being used for leadership programs by the foundation, but it's a real treasure. Not as well known, but even bigger than the Spangler farm, was the Jacob Schwartz farm. And this farm was located basically where the modern day outlets are, on the east side of US 15, the bypass. It was very large. It was designated a Second Corps hospital, but you can see how many troops they treated, and it had troops from the 3rd, the 5th, and the 6th Union Corps, and a large number of Confederate troops. Many of the wounded survivors of Pickett's charge were taken to the Jacob Schwartz farm. And this is a map. The line drawing is from Mr. Coco's book, showing where this farm was located. The aerial photo on the right, you can see US 15 in the upper corner, and the letters basically designate where the farm was. The structure just above the letter A is where the theater was that's now the Cider Restaurant, just to give you a reference as to where this hospital was located. And it was in many locations geographically. It was in the barn, it was in the ridges and hills. There were far more injured soldiers that needed to be taken care of than could be accommodated in the barn. And you can see, like the seminary building, it was open for a period of time afterward. It's not just a matter of a few weeks. If you can go back and get to videos that were done, probably in the early 2000s, the Gettysburg Daily videos, my fellow guide Phil Leachak has an excellent treatment of these medical facilities, and Phil is holding in his hand a very good book, Grappling with Death, about the Union Second Corps Hospital by Roland Mouse. It's a very, very well-researched, very good book about this very busy hospital, now out basically where the outlet mall is. A few Confederate hospitals to mention. The John Edward Plank Farm still exists. If you look at the map and get oriented, the Fairfield Road cuts across the upper portion of the map. On the right-hand side of the map is the Emmitsburg Road. So we're talking about an area that is adjacent to Willoughby Run. It's a very busy part of the battlefield, with part of Reynolds' First Corps marching through there on day one, and part of Longstreet's countermarch on day two going through that same area. But this was a division field hospital for John Bell Hood's division. One of the very busy surgeons there, who was an operator for this division was Dr. John Thompson Darby, who left a very detailed report of the surgery that he performed on John Bell Hood. It was a busy hospital. Over 1,500 wounded were treated. Over 500 were left when the Confederates left Gettysburg as being too badly injured to transport. And this is a description from an observer who lived near the plank farm about what the yard looked like, every place, or the house looked like, every place where wounded men hauled there in ambulances, on wagons, gun carriages, in every way possible, and using the Garner organ room, the family's musical instrument, their family organ, for an operating table. If you move to the other side of Gettysburg and go out past the Peace Light and continue on the Mummersburg Road, you will come to the Jacob Hankey farm. The house that's pictured here was not the wartime house, but if you look in front of the Jacob Hankey house, you can see a pump on a concrete structure. That pump was on the front porch of the then existing Jacob Hankey house. This was a very busy Confederate Division field hospital for Robert Rhodes' division. It was so busy and water was so needed that the pump was pumped dry, and the military medical staff had to place the pump under guard so they could get water. You can see there were 1,000 soldiers treated here, and a number of civilians migrated to this house for shelter, including the Crowth family who lived next to the seminary on Seminary Ridge. Right behind Little Round Top on the Taneytown Road is the Jacob Weichert farm. Again, a division field hospital, this time for the 2nd Division of the 5th Corps. It still exists. Tilly Pierce, who's certainly one of the most well-known civilians to leave a record, moved here with the Shriver family as the battle opened and helped nurse the wounded soldiers here. On the front porch of this farm, on the morning of July 3rd, General Weed, Colonel O'Rourke, and Lieutenant Hazlitt's bodies were laid alongside each other, all casualties from the day before and the vicious fighting up on Little Round Top. This is not as well-known a site. Again, a Confederate Division field hospital. This is located on the other side, the west side of Marsh Creek. There were some Michigan soldiers treated here who were wounded in the wheat field. If you remember the history of that fight, the 4th Michigan's Colonel Jeffords was bayoneted to death. But some of the more poignant stories that the civilians who lived on these farms left included things like this, that one of the children wrote later in life, "Mother was unable to keep the children away from the homesick soldiers. They would carve them toys and play with them endlessly. When Mother would go into the barn to take milk to the wounded, she would sometimes find a soldier asleep on the hay with a sleeping child on each arm." These men who were fathers quickly developed a relationship with these young children who reminded them so much of their children at home. The Jacob Keim farm is one of the last farms that I'll talk about. Jacob Keim didn't own the farm that he lived on. He was a tenant farmer for a gentleman who lived in Baltimore by the name of Josiah Bringman. Now, this was another Confederate Division field hospital, and this was largely Confederate General John Brown Gordon's soldiers who were brought there. One of the colonels in his brigade, Lieutenant Colonel William McLeod, was shot and killed and buried in the house backyard. The modern day photograph, unfortunately, the Jacob Keim farm does not exist, but the modern day photograph shows the driveway, the lane that was headed back toward the farm, and in the distance you can see an athletic building and the baseball diamond for Gettysburg High School, as that was the location of the Jacob Keim farm. Jacob Keim was my maternal great-great-grandfather and lived in that house. Unfortunately, I have no artifacts from that house, but I do have the family Bible. And just a brief treatment, if you will, of Camp Letterman. We've talked about its role. These are photographs from Professor Frazanito's book, Early Photography at Gettysburg. There's a series of 5 photographs that you can piece together to get an idea, really, of the breadth of that hospital. And the idea was that after surgeries were done and men were stable enough to be transferred, but maybe not stable enough to be placed onto a train to take to Philadelphia or to Washington, D.C., they would spend time at this hospital. The medical staff was still some Army medical staff, but an increased role for the Sanitary Commission and the Christian Commission. And as I said, this was open for 4 months and treated thousands of troops. Again, sadly, there's really not much left for us to see out there. Some of us would sure like to see the remaining ground preserved. As you can see with the modern map, there is development pretty much all over the ground except for one large swath of open field. And this, again, is one of the videos that my fellow guide Phil Leachak did. He's standing behind the giant food store, and Route 30 is off in the distance in front of the hotel. You get a sense for, number one, he's up on a hill. That elevation was important, along with water supply, roads, and railroads, but also a sense of the development that unfortunately has taken over in that ground. And I want to close with this because it's something that until you really study this that I think people don't consider. The fighting more or less stopped late on July 3rd, some skirmishing on July 4th. Both armies left Gettysburg early in the morning on July 5th during a driving rainstorm. They left 21,000 injured soldiers behind, and they took most of the surgeons that they had with them, leaving a handful of people to continue to care for these wounded. And the sacrifices that the medical staff, the surgeons made is, I think, often overlooked. These men and women for support services worked tirelessly for days on end, many of them actually developing physical problems of fatigue, of exhaustion. One surgeon wrote that his hands were shaking so much he couldn't operate anymore. Physicians were victims in the Civil War, as you can see from the slide. During the entire Civil War, 51 were killed in action, 281 died of disease. There was an assistant surgeon killed at the Battle of Gettysburg. He was at a forward aid station just across the road from the Lydia Leicester house up towards Cemetery Hill when his thigh was struck by an artillery shell. And Dr. Moore died at the Spangler barn 2 days later from overwhelming infection, as near as I can tell. So when we talk about the hospitals here at Gettysburg, I think, and this is from Kathy George Harrison out of Mr. Coco's book, it's important to remember, and I'm going to read this quote, "The story of the hospitals is symbolic. It is the end of battle and the end of war. It is not a Confederate story or a Union story. There is no North or South hidden in the meanings of the hospitals. It is a story of Americans coping against almost insurmountable odds for the common good."